Thank you. Good morning. Thank you all for being here today. I'm joined by Pat Allen, Director of the Oregon Health Authority, and Dr. Melissa Sutton. She's the OHA Senior Health Advisor and Public Health Physician. The weather's changing, and it certainly feels like fall is here. I absolutely can't believe it's already October. I think we can all agree that the past few months have been unusual, difficult, and a bit of a blur between the wildfires and navigating the challenges of the coronavirus. Distance learning for our kids, working from home, wearing a mask, and missing those in-person get-togethers with family and friends. Because of COVID, this year, we have learned to live with separation, grief, and ever-present uncertainty. I know it hasn't been easy. As we head into the new season, it's important that we update you on where we are with COVID in Oregon, what our next steps are, and the critical measures we must all continue to take to protect ourselves and our families. Let's start with where we are currently in the pandemic. Just over 6 months ago, I issued our Stay Home, Save Lives order to stop the rapid spread of the disease. Since then, we have reopened parts of our economy. We've learned a new way of living that involves masks, physical distancing, and the ever-popular Zoom room conferencing. Parents have really struggled with difficult choices, sending kids to daycare or school, or continuing the impossible task of working from home while parenting and teaching. We've also come across some newfound experiences that can only be realized under the bizarre circumstances of this pandemic. Connecting with old friends for a virtual drink, meeting your doctor for a telehealth appointment, or like Dan and I did, adopting a furry friend to join our family. I will let Director Allen speak more to the data of Oregon's current COVID numbers, but we have certainly seen a rise in COVID cases recently. This was to be expected coming off the Labor Day weekend and the intense wildfires that forced so many Oregonians from their homes. But colder, rainy weather is coming. Oregonians are certainly going to be spending more time indoors where COVID spreads more easily, and the days are going to get shorter too. And I can only imagine that if we're sick of COVID and physical distancing now, it's only going to get harder as we enter the winter months ahead of us. We see over and over again that COVID does not discriminate. It doesn't matter if you're old or if you're young. It doesn't matter your race or political beliefs or religion. It doesn't even matter if you're President of the United States. COVID can find a way to any of us. Our state epidemiologists and our public health experts and our doctors continue to work tirelessly to understand the disease and how it's impacting Oregonians. They continue to explore new ways to fight the virus and to find out how we can continue to protect each other. This will include maximizing our testing capacity through new resources Oregon will be receiving from the federal government. More than 100 million tests will be divided out to the states through the end of the year. We anticipate Oregon's share will be increased to roughly 80,000 rapid antigen tests per week. This is huge. But let me be very, very clear with all of you. It's not going to solve all of our problems or answer all the questions about the virus. With this increased testing capacity, we hope to be able to diagnose more people quickly so they can get the care they need. We want to identify more cases of COVID so we can also isolate and quarantine people and help to contain the virus. We also want to use them to prioritize our testing for our most vulnerable communities, such as our migrant and agriculture workers, our communities of color, and our seniors. Testing is an excellent tool to give us a more full picture of where the virus is hiding in our communities. Unfortunately, it's not a cure-all or the solution to all of our problems. We cannot test our way out of this pandemic. Without all the other safety measures, we continue to hammer home with you the physical distancing, avoiding large gatherings, and wearing a mask. Testing won't do anything to stop COVID in our communities. The events at the White House this past week have only reinforced that. I wish I could tell you that with 80,000 new tests per week, that would enable us to open all of our schools, but it won't on its own. Our Oregon health experts, together with school administrators, will be reevaluating our school metrics in the coming weeks, and we'll have an update for you on that very soon. However, I'm here to remind you that we all have a responsibility to stay the course to save lives. Wash your hands, practice physical distancing, wear a mask, and please keep avoiding those large gatherings. And also, to add one more thing to the list, please, please, please get your flu vaccine. We will get there. And just remember, when you're having a tough COVID day, always know that there is someone nearby that's feeling the same way you are and is continuing with all of these safety measures, because we all know that the more we do them together, the quicker we will find a way out of this crisis. Stay strong, take care of each other, and with that, I'm going to turn it over to Director Allen to talk about our strategy for deploying the new influx of tests.
Thank you, Governor Brown. Before I talk about today's testing news, I want to provide a brief overview of the virus in Oregon today. Over the past few weeks, we've seen a steady increase in daily cases, tied largely to social gatherings of various types. We have reversed the progress we made in the late summer, and our most recent modeling shows the virus is spreading more rapidly. Cases have increased by 25% since August 31st, which marked the endpoint of our 5-week downtrend. The average number of daily cases has grown from 220 during the first week of September to an average of 285 cases. This most recent surge in cases is an indication of how unrelenting this virus can be in spreading and how unyielding we need to be to stop it. As of today, we've recorded 35,340 confirmed and presumptive cases of COVID-19. And sadly, we've reported 581 deaths, including 9 today. The rising case numbers should catch everyone's attention. COVID-19 is a stubborn enemy. It will not go away easily or soon. Rooting it out of our homes and our communities requires all of us working together. That's why I'm happy to join Governor Brown today to announce a major development in Oregon's testing strategy. As the governor described, Oregon will receive 60 to 80,000 new point-of-contact rapid antigen tests from the federal government each week through the end of this year. These tests should roughly double our current testing capacity. These tests will help diagnose more people who have COVID-19 so they can get the care and support they need. And just as important, these tests will help reduce COVID-19 transmission and ultimately rates of infection over time, because we'll be able to identify more people who have the disease and their close contacts so they can isolate themselves and avoid putting other people at risk. This added capacity also allows us to expand our testing guidelines. Under our new guidelines, we're not only recommending testing for everyone who has the symptoms of COVID-19, regardless of the severity of their symptoms, we're also recommending the testing of all close contacts of people who are infected, regardless of whether or not a close contact has any symptoms. Again, by expanding our testing capacity and the number of people who should be tested, we'll cast a wider net, identify more cases, and cut off more paths the virus can use to spread, especially in counties experiencing large outbreaks. Yet no amount of testing in and of itself will suppress the spread of the virus. Testing is a vital part of our strategy to suppress COVID-19 in Oregon, but testing must be supported by robust case investigation and contact tracing, isolation, and quarantine, as well as the personal actions we all need to take to prevent transmission. Wear masks, avoid large groups, keep physically distant, and wash your hands thoroughly. The 60 to 80,000 tests we're going to receive is good news. However, rapid antigen tests have strengths and limitations. They're fast. The Binax Now antigen test can diagnose COVID-19 in just 15 minutes. These tests provide accurate, positive results. But like other COVID-19 tests, false negatives are also common, even among people who have COVID-19 symptoms. We don't yet know if false negatives are even more common among people who don't have symptoms because validation studies are still underway. These tests must be administered by a medical professional or at a location that is operating under a federal waiver from regulations that apply to laboratory testing. OHA has worked with the governor's office to develop a comprehensive strategy for distributing these tests. Dr. Melissa Sutton from the Health Authority led that work and is here today to give us more details. But broadly, first, we're targeting our distribution to counties and long-term care facilities that have been affected by wildfire. Second, we'll also deploy the tests to outpatient or mobile locations that are currently performing COVID-19 testing. Tests will be deployed statewide. Tests in outpatient settings will be used to implement our updated testing guidelines, which prioritize testing for all symptomatic persons and all close contacts of those cases, regardless of whether or not they have symptoms. In addition, we'll prioritize testing for the communities who've been hardest hit and most disproportionately affected by COVID-19, including migrant and seasonal farm workers, communities of color and tribal communities, and people living in congregate care settings. We'll also focus on places where people are most vulnerable. As we distribute the first wave of Binax Now tests, we'll work to expand licensed testing sites to include congregate care or living facilities, Department of Corrections facilities, and other community testing locations to bring tests to where they're needed most. We will deploy these tests to increase testing for students at staff at schools. We'll coordinate with school-based health centers and other healthcare partners to deploy these tests in K-12 schools and Oregon's colleges and universities to support testing of symptomatic students and staff, close contacts of cases, and facilitate rapid outbreak investigations. Finally, we'll maintain a strategic reserve of tests to address outbreaks and maintain testing beyond December in the event the federal government is not able to continue sending rapid antigen tests to us. I want to be clear. This additional testing, while critical to controlling COVID-19, does not replace our metrics for opening schools. In order to reopen schools safely and sustainably, we must reduce the amount of COVID in our communities. While we're moving fast to put these tests in the hands of healthcare providers, I want to emphasize that it's important to understand the limitations of COVID-19 testing. No COVID test is 100% accurate, and false negatives are common. A negative test result does not rule out the possibility of COVID-19 infection. A negative test is not a free pass. A negative test doesn't mean you can go visit an elderly family member without risk. A negative test doesn't mean you can stop wearing your face mask. We don't want anyone to stop taking precautions against getting or spreading COVID-19 as a result of a negative test. Now I'd like to introduce Dr. Melissa Sutton, who's one of our senior health advisors, to talk more about what patients need to know when they get a COVID-19 test. Dr. Sutton?
Thank you, Director Allen. As you and Governor Brown have both said, I want to emphasize that testing is not a silver bullet that protects you from COVID-19. Testing is important, but it is not infallible. Test results can be wrong. Here's what you need to know as a consumer of a COVID-19 test. If you get a positive test, you have COVID-19. COVID-19 tests are very accurate in identifying people with the virus. False positives are uncommon. Take these steps immediately. Talk to your healthcare provider. Isolate yourself for 10 days and until you are fever-free and feeling better for at least 24 hours. And answer the phone when public health calls. If you get a negative test, understand that you are still at risk of having and spreading COVID-19. False negative tests are common with all types of COVID-19 tests and also with rapid antigen tests. If you get a negative test result, please don't change your behavior. You should still wear a mask, physically distance, wash your hands, avoid gatherings, and be cautious when visiting vulnerable friends and family members. I would also add that these additional rapid tests will expand testing access to our schools, but we are still going to need to monitor school metrics closely. The metrics are what matter the most. As a mother of 2 school-age children, I want school to return to normal as soon as possible too, but only when it's safe for our children and teachers to return. And with that, I look forward to any questions. Governor Brown.
Thank you, Dr. Sutton. Nikki, I think we're ready for questions.
Everybody okay?
We can, yes.
Governor, question maybe for Dr. Allen, but you had mentioned about that there is some reevaluation going on about the metrics for opening schools again in the coming weeks. Are we talking about lowering county or state COVID benchmarks, and when would this happen?
Thank you, Lisa. We're still exploring this issue, but I think it's fair to say that the statewide metric, frankly, is quite challenging for communities around the state. And my top priority is to make sure that we get our kids back into school safely. We want to make sure that we can protect our kids, our teachers, and our professional staff in our schools as well. We will be evaluating these metrics over the next couple of weeks. I think it's a good opportunity for us to continue our conversations with superintendents across the state, with teachers as well, and with parents as well. As you well know, metro area Portland looks very different than, frankly, Bend, and that looks very different than Ontario. So we have a great variety of both geographic density and cultural differences across the state. We want to work to keep people safe, our students, our teachers, and our professional staff, and get our kids back into school as quickly as possible. Director Allen, I just want to clarify for the record, you are not a doctor, correct?
Nor do I play one on TV.
Okay.
Thank you. I think the only thing I would add to that is the governor alluded to the statewide metric. That's the requirement that regardless of local metrics, state testing positivity, the percentage of tests positive at a given time, need to be below 5% for a 3-week period. And I think we've got enough experience now to be able to look at the utility of that metric as an indicator of a broad level of coronavirus in the community generally, and ask whether that statewide metric is indicative enough of disease that it should override local metrics around numbers of cases and local positivity. We'll be looking at all the metrics, but I think that's an example of the kind of thing we'll be evaluating.
Hi, so I had a question about how these tests would be used in schools, and can you give us an idea of how this will help in an outbreak?
Sure. I'm going to turn that question over to Dr. Sutton.
Hi, Lachey. So we will be sending these tests out to both healthcare providers serving our K through 12 communities, as well as school-based health centers and student health centers on university and college campuses statewide. In terms of how they will be used to support outbreaks, they can be used to test in an outbreak setting, And they're actually quite good for providing very fast results specifically for that setting.
Lachey, I would just add that while the testing component is really important as a piece of the puzzle, we absolutely cannot test our way out of this pandemic. And the increased testing capacity is certainly not a hall pass to flaunt safety protocol.
Yeah, hi, Governor. Yeah, I'm here. Can you hear me?
Yes, we can hear you.
Yeah, okay, go ahead. Here at the University of Oregon, we've been seeing an increase in cases in Lane County. They've been seeing an increase in cases. What are you doing to help get a lid on that area with the students coming in? And how does that affect your thinking about the green light for Pac-12 football, which is supposed to come to Eugene on November 7th?
I'm going to turn those questions over to Director Pat Allen.
Thank you, Governor. I think what's going on in Lane County right now, I've had a conversation with the health officer, and it's actually a really good illustration of how these tests can be useful. There's not any one particular thing going on in Lane County right now that's driving the increase in cases that they've seen. There are cases from students coming back to school for arrival testing. There are cases from students being on campus and interacting. There are long-term care cases. There are workplace outbreaks. It's a little bit of everything. And these tests really are good at being able to deploy in the face of outbreaks. And if you think of each of those examples I used, each of those positive cases has a network of people around him or her who potentially have coronavirus. And so being able to more broadly test those contacts, identify cases very, very quickly, not waiting 2, 3, 4 days or more for a molecular test, really will help us get ahead of those cases. And whether in Lane County or anywhere else will help address that. I guess I don't want to say a lot about Pac-12 football other than to say, talking about football in the context of not having an audience is a really different animal than talking about bringing together large crowds of fans and those kinds of things. I think last week it was, I may have said what worries me most about any sporting events are less the event and more fans gathering together in ways that aren't safe. Big groups of people, whether they're tailgating or whether they're at a stadium, are a challenge. And so, again, we all need to be really vigilant about not gathering in large groups indoors, wearing masks, washing hands, and staying socially distant.
Quick follow-up. Last time everybody talked, this is pretty much a problem in Eugene and in Corvallis. Have you seen any other of the universities having an uptick?
I'm not aware of data that particularly points to large school-related outbreaks anywhere else, though obviously U of O and OSU are our very largest campuses, and so there are certainly likely cases, just not big enough to have become notable.
Gary, I'm not aware. I'm not aware either. I will just say that a number of the campuses delayed their opening because of wildfire, so that probably is challenging the data that we have in terms of campuses right now. Probably take a couple of weeks.
Thank you.
Yeah, I'm here, thanks. Just a quick question, given some of the things that Director Allen was just talking about. Governor, there is some talk about legislators wanting to delay the session next year because of concerns about opening the Capitol up to the public, but problems that could create. Would you support delaying the session by months, even if it means the public can safely access the Capitol?
Dirk, I think what's most important about the legislative process is that the public have an opportunity to weigh in on legislation, whether that's through technology, Zoom room type technology, or through telephonic technology. And obviously, we know that much of the business done at the state capitol is done through personal relationships. That's going to be really challenging in a COVID environment. So I know that there are work groups both at the legislative level and with folks who are lobbyists in the building. I expect them to come up with some solutions that ensure that the public can fully participate in this process. Certainly having a delay for a couple of weeks, a couple of months should be on the table.
Thank you.
I am. Good morning. I believe the last update, Governor, we received regarding events was that they were canceled through the end of October. We've been hearing now that some Portland Metro venues won't be able to hold events until at least next summer. Is that accurate, and will you soon be releasing updated guidance regarding events?
Brenna, I'm not sure anybody here has that information.
Well, we've not changed any guidance. I think what you're seeing are individual organizations making decisions based on their own logistical and financial needs and those sorts of things. There's nothing we've changed that would be driving anything that I'm aware of.
Will you have updated guidance soon regarding when large-scale events can be held? Because I know the last update was through the end of October. That's coming up.
Well, large-scale events are tied largely to reopening metrics and that sort of thing, and they continue to be. So, I think the biggest issue would be rates of disease coming down and allowing us to make a change, likely in the presence of an effective vaccine that's in wide use.
Thank you.
Good morning, Governor Brown. Yes, I'm here. Can you hear me?
Yes, we can hear you.
Hi. I had a question about kind of looking ahead into the fall and winter. Do you foresee needing to take stronger measures to slow the spread, specifically closing restaurants and bars, reducing the gathering size limit?
Look, my top goal as governor is to protect the health and safety of Oregonians, and Oregonians, frankly, have done a really extraordinary job complying with safety protocol, from physical distancing from loved ones and family members and friends to wearing masks that, frankly, have all become part of our wardrobes. My goal will continue to keep people safe. We're going to continue to make decisions based on science and data. And frankly, all options continue to be on the table in order to achieve those goals.
Governor, can I add to that?
Sure.
Just quickly, I think we are all concerned about what happens when people move indoors. And we kind of seem to always then get to the question about restaurants and bars. What I really want people to do as they move indoors is not do it in large groups, in unventilated spaces, without masks. And I'm as worried about people's homes as anything. These social gatherings that we've seen are not typically in commercial spaces. They're typically in people's homes. And so I really like to maintain the focus on the things that we know are dangerous, which is gathering in large groups indoors, not wearing masks, not washing hands, and indoors being in poorly ventilated spaces.
And Claire, the only thing I would add is that what happened at the White House a week or so ago with the announcement and reception regarding Amy Coney Barrett is a great example of how to spread the COVID disease in indoor, formal or informal social gatherings.
Thanks.
Yes, I am.
Go for it.
Hello?
Go ahead,
Oh,
please.
hi, Governor.
Yes.
I'm sorry. I was I have a question about what counties will the rapid testing be deployed to first?
Well, we want to make sure that the rapid testing gets to our most vulnerable Oregonians, and so that would certainly include the communities that have been devastated by wildfire. Dr. Sutton, do you want to pick that up?
That's correct, Governor Brown. The test will be deployed first to areas affected by wildfires, and thereafter they will go out to all counties statewide.
And can I have a follow-up to that, Governor?
Sure.
When will these tests be going out? Is it in the next week? What's the timeline?
So we have received an initial shipment of 15,000. Those are going out now to wildfire affected areas. We will be receiving, we believe, 80,000 over the next week, and they will begin deploying immediately.
Thank you very much.
Yes, I am. Hi, thank you. Governor, you just mentioned the outbreak at the White House. If you were to get COVID-19, what hospital would you go to and why? What treatments would be administered?
Just for the record, both the first gentleman and I were tested early on, probably in March. We had probably what is typical winter crud that we know was transmitted from a friend who was traveling overseas, so we were tested at the time. My physician is located in Salem, and I would expect, given that is where I'm spending the bulk of my time, that I would be treated at Salem Hospital.
Okay, may I ask a follow-up? Considering each hospital can treat patients differently, as we've seen, has the state studied which hospitals have been more successful with patients? You know, for example, aggressive treatments, any sort of trials?
Dr. Sutton, you want to tackle that one?
We have not studied that. I think there are a lot of emerging therapies, and they are being studied rigorously nationwide. Locally, we do participate in a COVID-19 hospitalization surveillance program. So that data is fed to a larger pool of patients that come from many states, but we are not studying that here in Oregon, just in Oregon.
Yeah, good afternoon, Governor. President Trump told us this week that we should not fear COVID, that we should not let it dominate life, that Americans should just get out there. Two questions for you, Governor. Will the president's statement drive any change in Oregon policy, your policies? And if not, how do you expect those statements to complicate the ability to advance that policy?
What I will say about this, what is really, really clear from what happened at the White House these last week or so is that we cannot test our way out of this pandemic, and flouting our safety protocol is a recipe for disaster. So I think the answer to your first question is no, other than it will certainly intensify my efforts and my urgency around ensuring that Oregonians across the state are complying with these critically important safety protocol that save lives. And the life you save could be your neighbor, your friend, your favorite aunt, someone you deeply care about. In terms of the second question, could you repeat the second question, Les?
Yeah, you sort of touched on it, but if you don't expect to change any of Oregon's directives based on the president's views, how do you expect this going to complicate the ability to drive ahead to get Oregonians to comply, as you just said?
I think that's really a challenge for the entire United States of America. When we have an administration that is flouting scientific data and CDC guidelines, it is really challenging for Americans to inform themselves and to understand and to make sure that they are in compliance with the best science and data in order to protect themselves and their family members and their neighbors. I think for me, what I've been so proud about in terms of Oregon is that despite all of the challenges, we have been surrounded by hot spots to the south of us, to the north of us, even to the east of us in Idaho, that Oregonians continue, for the most part, to comply with the safety protocol, because Oregonians understand the science and the data, and they understand common sense. And I honestly have been really proud of the work we have done in this state. And our results, frankly, illustrate that very, very well.
Yeah, can you hear me?
Yes, we can hear you, Rachel.
Great. Governor Brown, in late summer, you said that if case counts and test positivity didn't decrease enough to allow schools to reopen, that you would reevaluate restaurant and bar closures. Those metrics haven't improved, at least in Marion County and for the second largest school district in the state. Has there been any new move to reevaluate other things that might allow schools to open sooner here?
I think the issue for us is we are really taking a look at the science and data and our metrics regarding schools. As I said, I want to make sure that we keep our kids, our teachers, and our professional staff safe. We now have other states that have tried different metrics and maybe seeing different results. So we're going to look at best practices from states, frankly, in the region and around the entire country. I know that folks continue to question the decision not to close bars and restaurants, but what we are trying to do here is make decisions based on science and data. And the information that we have is that it is the informal social gatherings, like the one we saw in the White House a week or so ago with Judge Amy Coney Barrett. It is getting together for a friend's 60th birthday party. It is celebrating a quinceañera. These events, these informal social gatherings, are really contributing to the spread of COVID, and that we as Oregonians have to, if we want to get our infection rates down and we want to get our kids back in school, we all have to make sacrifices. And it's really, really hard. I know that's hard, but we have got to really focus on extremely limiting our social gatherings, particularly as the weather gets rainy and cold and we have to move indoors.
Yes, I'm here. I would like to follow up on Dirk's question. Governor, have you had any talks with legislative leadership or others about potentially delaying part of the 2021 legislative session, which could involve needing to pass a state law, which presumably, if that were to happen, would be done at a special session? Have you, as part of that, have you thought of bringing that up for the special session you said you expect to have after the election?
Dick, the answer to your question is, have I had that specific conversation with the Senate President and the Speaker? No, I have not. I've certainly had that conversation more informally with legislators and others that are engaged in the advocacy process at our state capitol. Here's what I would say. I believe that Peter Courtney is the longest serving Senate President in Oregon history. And the Speaker, Tina Kotek, also has a very strong record of strong leadership as well. I'm confident that they, in working with legislators on both sides of the aisle, will make good decisions, that they will work to protect their members, a number of whom are medically vulnerable, that they are very committed, as I am, to making sure that the public has an opportunity to weigh in on the legislative process. And I'm sure over the next few weeks that we will continue to have these types of conversations about how we can protect the public and ensure that the public has an opportunity to fully participate in the legislative session. As you know, it's a long legislative session. We have to balance the budget, and I'm confident that we'll reach a decision that can address these concerns.
Thank you.
Thanks, everybody.